Okay. Right, so good afternoon, members of the press, and welcome to our briefing on the status of COVID-19 in the country. This is our 636th brief, and so fellow Kenyans, on the 21st of November this year, the Cabinet Secretary for Health addressed the country through a press briefing at which he gave a number of directives relating to vaccination. It will be recalled that on that day, similar to a number of days before and since, infection rates and hospitalizations were relatively low. Our positivity rate on that day was an impressive 0.7%, and although we had 350 cases in hospital, with 20 patients in ICU and 113 on supplemental oxygen, we knew our situation was not very bad. Indeed, in subsequent days, our hospital cases reduced. On December 7th, for instance, cases in ICU had dropped to only 2, with another 52 on supplemental oxygen across the country. Our positivity rate on the 7th of December remained at 1.6%. At the time we were issuing the directives on the need for vaccination, we expected cases to rise. And today, as we speak, 3,328 people have tested positive of the disease from a sample size of 11,197 in the last 24 hours. This puts our positivity rate at 29.7%. We were, however, confident then that if we had more of our people vaccinated, it would be possible to still manage our situation, as many would have escaped severe disease despite getting infected. With the increase of infections following the onset of the Omicron variant, we still find that those who are vaccinated perform better against the disease. And this is important for us to repeat. Those who are vaccinated still perform better and have better outcomes than those who are not vaccinated. Therefore, this means that all adults in the country should be vaccinated in the shortest time possible to ensure that we have as many people as possible protected from severe disease. When we look at the picture globally, the global figures indicate that to date we have 8.47 billion doses of vaccines that have been administered, with 3.63 billion people fully vaccinated. So far, in the country, we have received 23 million doses of vaccines. And as of today, we have managed to vaccinate about 9.2 million Kenyans. We are slightly under 1 million less of our target of 10 million people, which we hope to attain by the end of this month. Over 5.4 million people aged 18 years and above have received the first dose. 3.7 million of those aged 18 and above are fully vaccinated. We have also managed to vaccinate 13,845 people aged between 15 to 18 years of age with Pfizer vaccine for their first dose. And so, fellow Kenyans, in line with the national regulations and legislation, the Kenya government recognizes all the COVID-19 vaccines that have been approved by WHO. Our government, through our regulatory agency, the Pharmacy and Poisons Board, has authorized the use of the following WHO-approved vaccines. 1, Pfizer-BioNTech. 2, Covishield and AstraZeneca AZD1222. Janssen, developed by Johnson & Johnson, Moderna, and Sinopharm and Sinovac Coronavac, as well as Bharat Biotech BBV152. That's the Covaxin vaccine. These vaccines are available, and we emphasize these vaccines are available for free in over 3,000 vaccination centers throughout the country. If you want to find out a vaccination site that is nearest to you, you can get this information from the Ministry of Health website at www.health.go.ke. As part of our COVID-19 heightened containment measures, the National Emergency Response Committee on Coronavirus on the 21st of November directed that everybody seeking in-person government services should be fully vaccinated and proof of vaccination availed by the 21st of December 2021. In public places, all persons must show proof of vaccination for admission, for example, into national parks, game reserves, hotels, bars, restaurants, as well as use of public transport means, including domestic flights, train, and PSVs. All visitors, tourists, and travelers from Europe must be fully vaccinated and provide proof of vaccination before entry into the country. These guidelines have therefore been developed to guide public interaction and operation at public facilities in line with the NERCC recommendations. It is important to note that these guidelines may be reviewed depending on the COVID-19 disease trends globally, but also within the country. It is important that we emphasize to you, in terms of proof of vaccination, what will be required. When you attend any organized event, be it a wedding, a funeral, receptions, organized parties, conferences, sports, trade fairs, workshops, you will be required to show proof of vaccination. Should you attend an indoor concert, theater, dance, symphony events, you will be required to show proof of vaccination. Licensed hotels, restaurants, cafes that offer table service, both indoor and patio dining, that includes liquor tasting rooms, wineries, breweries, distilleries, you will be required to show proof of vaccination. Pubs, bars, lounges, again, while visiting these facilities, you will be expected to show proof of vaccination. This includes nightclubs, casinos, movie theaters, game parks, game reserves, museums, supermarkets, shopping malls, indoor markets, banking halls, transport services including international and domestic flights, train services, PSVs, border, and taxi. You will also be required to show proof of vaccination in all government offices and all parastatal offices. The following requirements apply with respect and above to all those events and facilities. The event organizers or the facility manager or the government or parastatal office concerned must ensure the following. Issued by the Ministry of Health for the prevention and control of COVID-19 have been observed. This includes, of course, hand washing, sanitizing, physical distancing, wearing of face masks, temperature checks, observance of signs and symptoms of COVID-19. All workers and service providers must have undergone COVID-19 vaccination and must possess COVID-19 vaccination certificates. All participants must provide a vaccination certificate as proof of being fully vaccinated against COVID-19. No participant, employee, or service provider should be granted access into a facility if they are not in possession of a vaccination certificate. Exemptions from vaccination against COVID-19 on medical grounds may be issued by a licensed medical practitioner. Children and adolescents below the age of 15 years are exempted from this requirement. No vaccination certificates provided by a participant are to be retained within the premises, or that the vaccination certificates are used for any other purpose other than for the confirmation of vaccination status. A person, including a parent, must be fully vaccinated if the person is leading, supervising, or assisting in a program that touches on children or youth, or even adults on a voluntary basis, including when they receive an honorarium for that purpose. Finally, it is the sole responsibility of an event organizer, facility manager, government or parastatal office to ensure that the above requirements are met. In the event of non-compliance, action shall be taken, which may include the following: withdrawal of license of the institution and of court proceedings. Each establishment or facility shall be required to nominate or designate a person responsible for verifying vaccination certificates at all facility access points. Any person who has received his or her vaccination can access it through the Chanjo system, through the portal, at health.go.ke. You can create and sign up create an account, and you'll be able to then download your certificate from that portal. The vaccination certificates can be presented in hard copy or in digital format through any smart device. Each vaccination certificate must have a QR code, which then will be used to verify the details of the individual, the vaccine, the place, and the time the vaccine was administered. All persons are tasked with verification of COVID-19 vaccine certificates can download QR code scanners, and these can be used for the verification process. Upon scanning using the QR code, the verifier will be directed to the MOH portal, where a copy of the bearer's vaccine certificate can be viewed and verified. The verification will be against the person's details when it comes to the ID, passport, and driving license details that were provided. Fellow Kenyans, with regard to the international travelers, our port health officers at all points of entry shall be required to verify vaccination certificates. On the other hand, all travelers must provide, and this is important, we've received many questions on this, 1, proof of a negative COVID-19 PCR test, valid 72 hours from the time of sample collection to the time of arrival within the country. Children below the age of 5 are exempted from PCR-based tests. Proof of vaccination will also be expected against COVID-19 with a WHO-approved vaccine. Children below 18 years of age are exempted from COVID-19 vaccination certificate presentation. We also require travelers to show us proof of submission of their daily health status into the Jitenge platform via *299#. And then, of course, travel documentation will be required as you come into the country. As we conclude, we want to state that while we know vaccines play a major role in this fight of COVID-19 disease, they cannot replace all the other measures. And so we continue to appeal to you to strictly adhere to the containment measures. Remember to wear your masks, your face masks at all times in public places. Maintain social and physical distance. Washing of hands with soap and water, and sanitizing, and of course avoiding gatherings, be they social or political. And finally, on behalf of the Ministry of Health, on behalf of our Cabinet Secretary, Mutahi Kagwe, I want to wish you all a Merry Christmas and a prosperous New Year. And for these activities, the festive activities, to have true meaning, we appeal to you to stay safe, protect yourselves and your loved ones. Thank you. Thank you. More questions?
Gloria from KTN News. My first question is, after the CDC reported that in order for us to scale up the uptake of vaccine, we need to change our strategy in terms of adopting things like the use of rapid antigen tests and also our surveillance, stepping up our surveillance. So are we likely to adopt this in terms of targeted vaccination, or maybe go for the mass vaccination? And then the other thing is, what are we doing? What is the ministry doing in conjunction with the county governments to just ensure that vaccination uptake is high in this area?
Thank you, Gloria. Any other last question? I think we'll tackle those questions, and I'll touch on the court order question and then invite DG to talk on surveillance, and Dr. Akwale will speak on the vaccination campaign. The directives that we've just given today are directives that are meant to protect the country, that are meant to protect the citizenry. While giving these directives, the NERCC was able to convene and review the global situation and to review the regional situation and the country situation. And most countries globally, if you look, have actually adopted the use of presentation of vaccination certificates while entry into public spaces. I myself have had the opportunity to be in a few countries, and I have seen it. In Glasgow, in the just concluded COP summit, for you to gain entry into the conference, for you to gain entry into some shopping malls, you had to present the COVID-19 vaccination certificates. These measures are in place to protect you and I. Right now, the Ministry of Health, in putting down these directives through the NERCC, is invoking the Public Health Act. We have emphasized that, yes, vaccination is not mandatory, but for you to be able to interact with other Kenyans, for you to be able to get the privilege of interacting and using some of these facilities, then you have to do so while protecting your fellow member, community member, by ensuring you're vaccinated. And that is a stand of the Ministry of Health. And so we encourage Kenyans to ensure that they are vaccinated. Like we've said, we've given instructions on how you can access your vaccination certificate. If you have any challenges accessing that certificate, you can reach the Ministry of Health. We will be on standby. We are not on holiday. We shall be there to facilitate these processes. Now, DG, if you could talk on the issue of surveillance.
Thanks, Madam CS. In terms of surveillance, of course, the surveillance system has been up and running since we reported our first case in March last year. And when the Omicron variant was detected in South Africa, of course, we also enhanced our surveillance system at the ports of entry, especially Jomo Kenyatta International Airport, because of international travel, but equally at all points of entry and also at community and facility level. And based on that, we carried out genomics sequencing of the tests that turned out positive, especially from travelers who arrived at Jomo Kenyatta International Airport. For example, on 7th of this month, out of the samples sequenced, 76% were positive for the Omicron variant, 18% was Delta variant. But 10 days later, that is on the 17th of December, all the samples sequenced turned out to be the Omicron variant. So basically now Omicron variant is a predominant variant at literally 100%. So we are still continuing the surveillance system, and it is based on that fact that of its high transmissibility due to the constellation of mutations that the variant exhibits in the S gene platform that made it be classified as a variant of concern because of increased potential for transmissibility. And that we are seeing because you have seen our numbers rise and our positivity rate now fluctuating at between 28 and literally 30%. We hope that we are going to plateau soon, because if you look at the past 3 days, on Monday it was 29.6. Yesterday it dropped a bit, 27 point something. Today it's back again to 29.7, so basically 30%. We hope that we are not going to tip over 30% and maintain it at that, and that will mean that we have a saturation of the infection and it can only come downwards. But for us to be able to achieve that, we need to work to ensure that we continue to comply with the non-pharmaceutical interventions and also up our game in terms of the vaccination, which my colleague will be able to speak to. But just additional information, for example, today we have 15 persons admitted in various critical care units in the entire Republic. Out of these 15, 10 are not vaccinated at all. So that's about 67% of the population admitted in critical care are not vaccinated. 5 are fully vaccinated. So even without an additional shot, you can see the protection accorded either with a single shot or the 2 shots of the vaccine in offering you close to almost 70% protection. And this is what has also been documented in the West. So vaccines actually work, and it is our intention this particular time to call on more Kenyans to turn out for vaccination. And as we go out there during this festive season, to ensure that we protect the elderly and the vulnerable, One, by ensuring that they come for vaccination. In case they have not been vaccinated, then when we have any gathering of any nature, let's have outside gathering. I know the weather is a little bit unfriendly, but if you are seated indoors, seat the elderly and vulnerable people by open windows. If it is cold, ensure that they're warmly covered in a blanket or a shawl, and ensure that there's proper circulation of air. Thank you. Yes.
The other question was on vaccination strategy. You're talking about, you made a call.
Litajibiwa hivi sasa.
You've made a call to people to avail themselves of the vaccine. But Africa CDC is saying for us to boost our vaccination rate, we need to take these vaccines to where people are. So in terms of vaccination strategy, what are some of the strategies that you are thinking of as the Ministry of Health to just help boost the targeted vaccine?
I think practically that is what we have been doing, because if you look at the outreaches, yes, practically that advisory is coming from Africa CDC belatedly, because that is exactly what we have been doing. You have seen us even during the celebration to mark Jamhuri Day, where we had even a tent during the celebration to ensure that those who come to celebrate that important occasion, those who have not been vaccinated, are able to access the vaccine. You have seen in the train stations, at the bus stops, the border rider sheds, in the markets, in the churches. We have gone ahead to ensure that we avail the vaccines to the people instead of using only a fixed post-vaccination strategy. So we are going to the people, and we will continue to go to the people to ensure equity and no one is left behind. But my colleague will be able to add more to that. Thank you.
Okay, thank you.